by Nami Los Angeles County Council with funding from the Los Angeles County Department of Mental Health. I'm Brittney WEISSMAN. I'm the Executive Director for Nami Los Angeles County Council. I'm going to make some opening remarks and then we'll call up our speakers. We're really so glad you're here to learn with us today. We have a lot to provide in terms of education and resources. But for those of you who don't know NAMI quite yet, NAMI is the National Alliance of Mental Illness. It is a national organization. We have affiliates who have programs and services all across the country. And here in LA, there are 12 such affiliates. We cover the entire county. So for those who would like to get connected, I'll tell you a little bit more about that in a few. So in LA County, like I said, there are 12 affiliates, and we work together through the council, which is the vibrant, strong affiliation. We offer programs countywide, like family to family, peer to peer, basics, all offered in English and Spanish. We have programs like NAMI in the Lobby in various clinics, and support groups, programs for high school students, and for teachers and faculty. Everything we offer is at no cost to the public, so we hope you'll take advantage. In addition to the kinds of free classes I just mentioned, we're very active in terms of advocacy and public policy support. I'm going to mention a few things that we've been working on the last year or so, and I'm very proud of this work, and we have a lot of people in the audience who work daily on this, so thank you very much. Some things that we've been very active on are LPS Conservatorship Public Education Workshop. We have been working side by side with law enforcement agencies on their CIT, Crisis Intervention Team training throughout LA County. We participate in almost every CIT program for all law enforcement agencies, telling our stories as family members and people who have lived experience with mental illness, which is a big change from years ago when we couldn't get a seat at the table. We've been active in the Prop 47 initiative around securing grant funds for new programs. Prop 47 was the initiative passed a year and a half ago to help people who have felonies get reclassified as misdemeanors. With the cost savings that happened through that, we're going to get some funding in LA County to provide services and programs. Very recently, we have been participating in the Measure H initiative. Some of you have flyers on your handouts and your tables and your chairs about Measure H. It's a local initiative that's on the ballot for March 7th. We are working very hard to get out the vote, so for those of you who have the flyers, be sure to give them a look. We support it very much because it provides access to permanent supportive housing for people we care about. So please participate in the March 7th election by mail or in person. Get out the vote. We've also participated in No Place Like Home, which is a statewide initiative on the similar kind of thing for permanent supportive housing. We also are very fortunate to be involved in several high-level countywide programs and groups, like the District Attorney's Criminal Justice and Mental Health Group, and we sit with the Los Angeles County Sheriff's Department in their Mental Health Group too. We also participate in the Office of Diversion and Reentry, which is a program of the Department of Health Services aimed at helping people with mental illness reenter society. The goal of our participation is, of course, to help people with mental illness get diverted from the law enforcement system and the criminal justice system into mental health treatment when appropriate. We've, of course, helped to implement and provide support for Laura's Law, assisted outpatient treatment. We participate in kind of communication with the mental health courthouse here in LA. And we have recently provided testimony to the LA County Board of Supervisors on things like expanding the co-response model, where we send out a police person and also a mental health person on an emergency call to deal with a mental health crisis, which is very important. If you like what we offer here today, I encourage you to participate in your local NAMI. Like I said, there are 12 throughout LA County, and the green sheets that are available in the lobby list each affiliate with contact information so you can reach out to the one nearest to you. Please visit our table with NAMI materials in the lobby. And please support us by participating in our NAMI Walks event, which is this year on October 7th. It's in Grand Park, LA. We had like 4,500 to 5,000 people participate last year. It was very exciting. It's a mental health awareness raising campaign and also a fundraising campaign, so we can continue to provide these kinds of programs and services at no cost to the public. Today, we're really glad to honor and have you here for our 3rd annual Parent and Caregiver Conference. The aim of today's program is to equip you with the tools and help and support to help your loved one, and also offer tips, providing self-care for yourself and your family. When I talk to parents of folks with mental illness, they tell me the same thing all the time. They express their experience as a journey, filled with ups and downs, relapses and recovery, blessings and challenges. Lots of detours, as our conference manager, Letty Baldero, says all the time. We've asked each of our presenters today to bring everything they have to bear: personal experiences, education, resources, sympathetic ears, and practical steps to take to provide hope and help to you and your family's journey with mental illness. On that note, I'd like to thank our sponsors for today's conference. We extend our thanks to the Department of Mental Health, the Los Angeles County Community and Senior Services Department, Project Return, 211 LA County, New York Life, Toy Loan and Volunteer Services, Center for Healthcare Rights, Harvage Consulting, Cal Duels, Recovery International, Dee Hirsch, SHARE, Starview Children and Family Services, Alliance for Research, Janssen Pharmaceutical, Mindful Warrior Project, St. Anne's, and Telecare. Please give them a round of applause. They also have resource tables in the lobby, so please feel free to check out their particular resources during the lunch hour. Also, let's extend thanks to our excellent, awesome conference planning committee, led by Letty, staffed by Leola, Jean, Sylvia from Nami, and also Melissa from the Department of Mental Health. And to our many volunteers, today wearing the green ribbons so you can ask for help. These folks dedicate their personal time to developing the Nami cause. So in terms of the agenda, you all should have received conference handouts. We're going to be in this room for most of the morning, and some of you are invited to stay for the afternoon too. We'll have a lunch break at around 11:45 where lunches will be available in these rooms to the side. We're hosting sessions on 3 floors of this building. This is the ground floor. The first floor is 1 up, and the second floor is 1 up from that. Bathrooms are located on this floor over here by the elevators. And translation headsets, as been advised, are in the back. If you need a translation headset, it's not too late. We'll be providing translation through the afternoon here in this room. Now I'd like to ask Dr. Jonathan Sharon, the new director of Los Angeles County Department of Mental Health, to present a bit. A bit of his vision for the department and how we all work together in the mental health system, the community, and within our family and friend circles to improve the lives of everyone affected by mental illness in LA. You can read more about his substantial and impressive bio in your brochure. We did have a few slides that were accompanying this presentation, which we're struggling to put up for you, but we will try nevertheless. In the meantime, please welcome Dr. Sharon.